everyone. This is the dissection of the back and the skeletal region and the posterior compartment of the arm. This muscle is the trapezius muscle. This is the right trapezius. And this is the left trapezius. As you can see here, the trapezius of the two sides form a trapezium. That's why this muscle is known as trabecular muscle. The origin of trabecuus is from the external occipital protuberance, superior nuchal line, its medial part, the spines of C1 to C7 vertebra, ligamentum nuchae, and the spines of D1 to D2 spines, thoracic vertebra. From here the fibers run laterally. So these are the fibers of trapezius running laterally. The trapezius is inserted into the posterior border of the lateral 1/3 of shaft of clavicle, the medial margin of acromion process, and the upper lip of the crest of the spine of scapula. This is the spine of scapula, and this is the upper lip of the crest of spine of scapula, to which the trapezius is inserted. So this is the trapezius muscle. In the lower mat, we can see a big muscle coming from below. This muscle is latissimus dorsi, as we can see on both the side. The latissimus dorsi origin is from the L1 to L5 spines, lower 4 ribs, and from the posterior 1/3 of the outer lip of the iliac crest. From here the fibers are running upwards, going laterally, and forming the posterior axillary fold, and it is on its way to insertion in the floor of the bicipita groove of the humerus. So this is the trapezius, and this muscle is the latissimus dorsi. This is the deltoid muscle. This muscle is the deltoid. The origin is of deltoid from the anterior border of the lateral 1/3 of shaft of clavicle, from the lateral margin of the acromion and the lower lip of the crest of the spine of scapula. So this is the origin of deltoids. From here the dangard runs downwards. It is inserted into the denta tuberosity, which is present on the anterolateral surface of the shaft of humerus. So this is the dentate muscle. This is the posterior compartment of the arm, in which we can see triceps muscle having 3 heads. This is the long head of biceps. This is the lateral head of triceps. And deep to long head will find the medial head of triceps. So this muscle is the triceps muscle. Now once we reflect the deltoid and the trapezius from the spine of the scapula, we can see the medial border of scapula. This is the lateral border of scapula. And this is the inferior angle of scapula, from which some fibers of latissimus dorsi arise. This is the latissimus dorsi. Along the medial border of the dorsal aspect of scapula, we can see 3 muscles. This is the levator scapulae. This muscle is levator scapulae. Below it, this is the rhomboidus minor. And below it, this muscle, from here to here, this is the rhomboidus major muscle. So along the dorsal aspect of medial border of scapula, 3 muscles are inserted from above downwards: levator scapulae, rhomboidus minor, and rhomboidus major. This is the spinous process of scapula, above which this is the supraspinous fossa, where there is origin of supraspinatus muscle. So this muscle is supraspinatus above the spine, and below the spine, this muscle is infraspinatus muscle. This is infraspinatus. Below infraspinatus, this is the teres minor, which is arising from the upper part of the lateral border of the dorsal aspect of scapula. So this muscle is teres minor, below which there is origin of teres major muscle from the lateral border of scapula. So this is the teres major. And this is the latissimus dorsi. So this is infraspinatus. This is teres minor. This is teres major. And this is latissimus dorsi. Now here in this region, we can see three important intermuscular spaces of the bank. This is the upper triangular space, which is bounded above by teres minor, below by teres major, and laterally by the long head of triceps. So this is the upper triangular space through which passes the circumflex scapular vessels. So this is the circumflex scapular artery along with the vein, which is the content of upper triangular space. This is the lower triangular space, whose boundaries are medially the long head of Pegasus, laterally this is the shaft of humerus, and above this is the teres major muscle. So this space is the lower triangular space, whose main content are radial nerve, this is the radial nerve, along with profunda brachii artery. So this is radial now, and this is the profunda brachii artery passing through the lower triangular space. Above it, this is the quadrangular space, whose upper boundary is formed by teres minor, this is teres minor, medial teres major. Medially, this is the long head of triceps, and laterally, this region is the surgical neck of humerus. So this space is the quadrangular space through which we can see the axillary nerve. This is the axillary nerve and its branches supplying the deltoid muscle. Along with the axillary nerve, we can see the posterior circumflex humeral artery. So these are the three important intermuscular spaces of the back. This is the upper triangular space, this is the lower triangular space, and this is the quadrangular space. There is one more triangle in relation with these muscles. This is known as the triangle of osculation. The triangle of osculation is bounded medially by the lateral border of trapezius. This is the lateral border of trapezius. Laterally by the medial border of scapula, and below by the upper border of latissimus dorsi. So this triangle is the triangle of auscultation, whose floor is formed by 6th, 7th ribs, the 6th intercostal space, and this rhomboidus major muscle. This space is less covered with muscles, and we can put a stethoscope and hear the auscultatory sounds very well. So this is the triangle of auscultation. Thank you.